Spring has most people I know shedding those heavy winter clothes and looking forward to getting out in the sun. Well, before you start soaking in those rays, you need to first consider ways to maintain your healthy skin. Dr. Alan Parks and Dr. Ben Bogucki from Eastside Dermatology Skin Care are here to help us make smart choices. And doctors, this is good, but it's also, you know, we've just seen the sunshine. So Dr. Parks, we want to get out in it. You're not discouraging people from doing that.
No, absolutely. We should go out and enjoy the sun. I too like to be out in the sun, but there are certain things that we can do to protect ourselves from the sun.
So Dr. Bogucki, what are some of those first things we should do? Sunscreen, I'm assuming?
So sunscreen is definitely very important. Anywhere where our skin is exposed, so I'm talking about the face and the neck, and definitely the back of the hands, you don't want to forget. Apply every day,
I do.
especially this time of year.
Hands.
Don't forget.
And it's also important to, one thing that we sometimes overlook is that clothes are the first barrier of protection against the sun. And there are things that we can do nowadays. Make sure that if you're going to be outside, that you wear a hat with a wide brim. T-shirts and fine cotton clothing don't offer a lot of protection. Fortunately now with technology, there's a lot of sun protection factor that's built into certain types of clothing that you can cover kids up at the pool, or for runners or golfers, you can buy them at sporting goods stores.
I've seen them, but I've been skeptical, doctor, that they really work. But you say they do.
They do.
Offer protection.
The technology is there. They do.
Dr. Bogucki, unfortunately, you are still seeing people come to you who have been in the sun too much, leading to cancers.
It's true. Unfortunately, the skin cancer incidence in the U.S. has been rising for decades, and we see no shortage of it in our practice. We were just talking patients of all ages, even in their 20s and 30s, come in with skin cancer. Now, we're seeing a lot of people this time of year. They're looking at their skin for the first time. They're wearing their short sleeve shirts. They're wearing their shorts, which is great, and they're noticing new spots that maybe weren't there when they were looking at themselves in the fall. Those are really the types of things you want to look for when you're looking at your skin. Anything new, anything changing. The most important thing to look for is any new dark spot. So a new mole, a changing mole, that should be pointed out to a dermatologist as soon as you notice it, because it could be an early sign of melanoma, which is the more dangerous type of skin cancer. Fortunately, melanoma is a little bit less common than the more common types of skin cancers, which are basal cells and squamous cells.
But you take care of them early then, right?
Absolutely.
The earlier the better, for sure.
Yes.
When you're looking at your skin, definitely moles are the first thing. But when you're looking for a basal cell or a squamous cell, these are actually usually present as kind of a red, scaly spot. Sometimes they can just be a pimple that doesn't go away. These are the types of things you definitely want to point out to your physician.
And people notice those, don't they, Dr. Parks, because they've looked at their skin more than you would, so they notice something different and they should question it.
A lot of times they do, but there's also areas like that you can't see on yourself, on your back or on the back of the legs, that you never see, and you're not aware of things being there. So we encourage most people to get like a full body skin examination, usually once a year. And the other thing that I often see is people come in for one spot that's okay, and I'll often find something that they didn't even know about.
SPF for Dr. Bogucki, for all of us, is confusing. 15, 30, 50. Do the numbers matter?
So confusing. The numbers do matter.
For most people, a 30 is more than adequate. If you're going to be outside for long periods of time, or if you get red very quickly or burn easier, then a number greater than 30 is helpful. It's important to remember that sunscreen fades over time, so to reapply it every couple hours if you're going to be out for a long time during the day. And the one mistake that a lot of people make is they don't apply enough sunscreen to the area.
Not all sunscreens are alike. You brought some that you sell in your office, and why, Dr. Parks, do you prefer these?
We know who manufactures them. We know what the ingredients are. There are some ingredients that are more protective, such as zinc oxide or titanium dioxide, that give a more complete block of both UVA and UVB light, whereas a lot of commercial sunscreens do not.
Dr. Bogucki, you said that you see a lot of younger people, so your message today is wear the sunscreen, but get out in the sun, but wear the sunscreen, no matter how old you are.
Wear the sunscreen, and not just for skin cancer. The most important thing is to protect yourself from skin cancer. But if you're worried about fine lines and wrinkles, you're worried about dark spots, red spots, photo aging in general, the best thing you can do is be very diligent with your sunscreen every day, even in the winter months, but especially as we get towards the spring and summer.
Doctors, thank you so much. Good advice as reminders as we're heading to spring and we're out in the sun. Thank you very much.
Thank you.